This is a health message DVD prepared by LVCT on HIV and health-related issues. It's also done in sign language by deaf signers who are service providers.
My name is Priscilla Wangare, nursing officer, more so on family planning.
What is family planning?
Family planning is the ability of a couple, a person, or sexual partners to attain the desired number of children by spacing or timing on their births.
Who can access family planning?
Everybody has a right to family planning, including the youth, and all family planning methods are available in all public facilities at no extra cost. Family planning is free.
What are some of the common family planning methods?
Family planning come in different types, and the common types of family planning are the condoms, we have the pills, injectables, IUCDs, and the safe days.
What is cervical cancer?
Cervical cancer is the commonest type of cancer among people living with HIV/AIDS. Cervical cancer is caused by human papillomavirus, which is transmitted mainly by sexual contact. Cervical cancer is more common to women who are sexually active, more so women of reproductive age, that is 15 years to 49 years, and they are advised to go for a pap smear each year.
What is a pap smear test?
Pap smear is a test used to detect cervical cancer.
My name is Lucy Wankyo. I'm a pharmacist by profession. I'm directly involved in issuing ARV medication to HIV-infected patients.
What is ARV medication?
ARV medication are medicines used to suppress the virus in HIV-infected patients.
How do ARVs work?
ARVs work by reducing the viral load in patients infected with HIV, and thus helps improve their quality of life.
When do ARVs work best?
ARV medication work best when they're in constant circulation in the blood system of the people infected with the virus.
What are the side effects of using ARVs?
Side effects are undesired reactions that occur with normal administration of drug dosages to patients. ARVs, just like any other medications, are associated with side effects. Some of them may occur with initial treatment and some may occur at later stages of the treatment. Some of the most common side effects of ARVs include rashes, yellowing of the eyes, diarrhea, and stomach disturbances.
What should a patient do to avoid side effects?
In order to avoid side effects with ARVs, someone needs to seek clarification from the healthcare professional. You need to adhere to your drugs well, and you need to report any unpleasant reactions that occur whenever you take the medication.
What is alcohol and substance abuse?
Alcohol and substance abuse is the excessive use of alcoholic drinks and substances that alter the mental status of a person.
Does alcohol and substance abuse affect patients if they are still taking ARVs?
Alcohol and substance abuse is dangerous in people taking ARV medication because it makes them risk forgetting taking their medicines.
What happens if patients abuse alcohol or drugs?
Patients taking ARVs and they abuse alcohol and substances risk forgetting taking their medication. It also alters the absorption, distribution, metabolism, and excretion of the blood in their system. This will make them develop resistance to medication early, leading to treatment failure.
Anthony Kenywa. I'm a laboratory specialist, mainly dealing with issues related to HIV and ARV monitoring.
What sort of tests are conducted?
In ART monitoring, the main tests are to look at the immunity, and to assess the immunity we do CD4 cell count. We also do kidney and liver function, which help us know how well these organs. We offer other services which include STI screening, tests for malaria, TB diagnosis, screening for STIs, and HIV testing both for adults and children. We also do early infant diagnosis, which is basically testing for HIV in children through a specialized technique called PCR. Testing is important because it helps you make informed decisions. Either way, if you're positive or negative, it really helps you to make informed decisions.
What is CD4 count?
CD4 is a marker on T helper cells, which are immune cells. These are the cells that are attacked by HIV when it enters the body. CD4 should be done once every 6 months, as they are used to show you progression.
What is liver function tests?
Liver function tests should be done at least once yearly, as they help us know how well your liver is able to metabolize drugs.
What is kidney function tests?
Like liver function, kidney function tests should be done once every year. This test helps us know how well your kidney is able to eliminate drugs.
What is hemoglobin tests?
Hemoglobin should be done at least once every 6 months, depending on the drugs you're taking. Hemoglobin helps us know your blood levels and iron levels.
What is CRAG tests?
Serum CRAG is a test for cryptococcal meningitis that causes meningitis in people who have suppressed immunity. That test should be done for anyone who has a CD4 cell count of less than 100.
What are the benefits of regular testing?
When you have HIV, your immunity is low, so frequent testing at the lab and screening is very necessary because you're prone to opportunistic infections. Once you're tested, you're able to access services for care. For instance, you're able to get ARVs, which helps reduce your viral load and helps improve your immunity.
What is adherence to clinical appointments?
Adherence to clinic appointment means sticking to the scheduled medical appointment, which ranges from nutrition advice, doctor's clinic appointment, and also to counseling services.
Should healthcare workers remind patients about clinic appointments?
Healthcare providers, they can remind the client on the appointment through the phone calls, through the SMS, and through community health workers. Clients need to leave their contact with the care providers. Then they need to give consent or give the permission for them to be contacted whenever necessary.
What is disclosure?
Disclosure is revealing or sharing one's HIV status to their partner or to others or even to care providers.
To whom should one disclose?
Disclosure can be done not only to their partners, but also to other people like the family members, the healthcare providers, their spiritual leader, their peers, amongst others. So far, quite a number of people, it has become easy to disclose to their partner, but still it's a big challenge when they are trying to disclose to significant others alongside their partners.
Is there still stigma after disclosure?
Yes, we can say there is still the stigma when it comes to HIV, and especially in our community, the major challenge that we have is due to stigma, and especially from others.
What are the benefits of disclosure?
Some of the benefits of the disclosure include early access to care and treatment. It also facilitates in the reduction of stigma. It improves adherence to care, treatment and medication. It enhances partner testing, which includes safer sex practices. It helps the HIV positive partner to receive the support from others and more so to other available support systems.
How should disclosure be done?
Before you disclose, you need to evaluate who, where, when, and why to tell, and the potential reactions that they can come out after the disclosure. And this can be done even by the help of a trained counselor. We're encouraging those who have known their status to disclose their status basically to their partner, and if they cannot be able to do that, with the help of a trained counselor, they can be able to be supported to do that. So regardless of the stigma, it's highly encouraged for one to disclose his or her status to the partner.
What is medication adherence?
In HIV management, the most critical aspect and the success of treatment is mainly determined by adherence to medication. And this means sticking to the dose, to the scheduled time that one have agreed with the healthcare worker to ensure that there is maximal suppression of viral load. And this can only happen if one is actually willing to follow instructions, since HIV is a chronic condition that may need chronic follow-up, and that one need to stick to those doses for the rest of their life. And that requires a lot of commitment from a patient. Hospital visits plays a role because one needs to be checked other things like how well one is doing, how they are also taking the medication, whether they are actually even getting side effects as a result of drugs. At the same time, even monitoring their organs to see if there is any effect as a result of drugs. For ARVs particularly, that is important that one have to have more than 95% in terms of adherence rate. And that means that one is able to suppress viral multiplication for a long time and prevent getting resistant virus, which in future becomes hard to treat.
What happens if a patient does not adhere?
The failure of that is that the virus may develop resistance and it becomes hard to treat, and that means that medicine may require to be changed from what known as a standard first line to probably second line drugs, which are a little bit hard to take. At the same time, they're also expensive for the patient, and that also may lead also to the quality of the patient becoming low, yeah, because one will probably start getting sickly all the time, getting a lot of opportunistic infections, and that may cause even a client to succumb to opportunistic infections.
What are some of the challenges facing patients?
It's a little bit a challenge because one of the things is actually even monitoring that adherence, and it is a challenge. But even to the patients, the most important thing is to have strategies of how to support the patients to adhere to their medication, including even doing other things like disclosure to get buddies who will help the client to remember when to take the medicine, or even use alarms. Most of people these days, they have phones, and they can be able to probably set their time on when to take their medicine.
Why don't patients adhere?
There are so many reasons which could contribute to that. One is like disclosure. The other thing is lack of enough knowledge and understanding of the patient of why they actually need to take the drugs. The other reasons, if one is having a lot of other drugs that one is taking, they may tend to forget, or they feel they have drug fatigue, that they feel they don't longer need to take the drugs anymore. The other things are depression, anxiety, which could actually lead to patients not taking their drugs appropriately, and that need psychological intervention.
What is PMCT?
PMTCT it's an acronym for Prevention of Mother-to-Child Transmission, and this is a strategy, one of the HIV prevention strategy that targets pregnant and women who have HIV from transmitting HIV to their kids. And children may acquire HIV from their mothers through various stages. They could get HIV during pregnancy, at labor or at birth, or during breastfeeding. And with the PMTCT targets the various stages in child development. And there are strategies which are used during pregnancy where a mother can be taking some ARVs to reduce the viral load that consequently leads to reduction in transmission to the fetus. The other way is during birth or at birth. Then at that point, a mother could be given some drugs at that particular point when they are at labor, and that reduces the transmission rate to the newborns. At the same time, the child could be given some medicine, ARV medicine, for a while to prevent the child also from acquiring HIV from their mother. So, and during breastfeeding, there are various methods that one have to take care of, which includes exclusive breastfeeding for 6 months. Well, the mother probably could also be taking ARVs to reduce the viral amount in the system that consequently reduce chances of maltransmitting to the newborn. For the past 5 years, there have been a lot of improvement in reducing the number of children who are born positive. And this as a result of PMTCT strategy as a HIV prevention mechanism that is employed targeting pregnant women. And it is important that all pregnant women actually get tested for HIV for them to get the benefit of the child being born negative. It is important that the mother have or safe sex during pregnancy, and not that alone. They also need to be taken care of in terms of malaria, because if the mother gets malaria, there is also a high chances that the child can also get HIV. At the same time, with the other conditions which need to be assessed, like anemia, which also may increase chances of the child getting HIV. So they need to get a follow-up, especially in antenatal care, to ensure that the protection is maximized for the child.
My name is Sarah Kitui. I'm a trained nutritionist.
What is the relation between nutrition and HIV?
HIV, just like any other infection, it increases the nutrient requirements and the energy requirements of the body. It may also interfere the way the nutrients are absorbed in the body, and also the nutrients, the way they are taken up by the body.
How does poor nutrition affect HIV patients?
People living with HIV have increased nutrient requirements, and if these nutrient requirements are not met, one may lose weight, and maybe become underweight, and attain a poor nutrition status. If one attains a poor nutrition status, this weakens the immunity of the body, making the body more vulnerable to infections, and maybe also hastening the progression of HIV to AIDS.
Does obesity cause a health risk to HIV-positive patients?
Obesity or overweight and obesity is also very common in people living with HIV. And it also poses a health risk to these people. For example, it increases it puts the body at a higher risk of other illnesses. For example, type 2 diabetes, and you also have hypertension and heart diseases.
What is your advice to HIV-positive patients?
At least eating a balanced diet of a variety of foods, and also 3 main meals per day, and engaging in regular physical activity enables one to improve health and also attain an ideal body weight. You also need to take regular body weight and BMI assessment.